Hello everyone, and welcome back to the channel. Today, we're rediving into a topic that is incredibly important but often misunderstood. A severe form of morning sickness known as Hyperemesis Gravidarum, or HG. For many expecting parents, the term morning sickness brings to mind some nausea and maybe occasional vomiting in the first trimester. It's unpleasant, sure, but generally manageable. But what happens when it's not just morning sickness? What if you so sick you can't keep any food or even a sip of water down? What if, instead of gaining pregnancy weight, you're losing it rapidly? This is the reality for those suffering from HG, and it's a serious medical condition that needs proper attention and care. So, let's clarify what Hyperemesis Gravidarum actually is, and how it differs from typical morning sickness. HG isn't just a bad case of pregnancy nausea. It's a debilitating disease of pregnancy. The key defining features are severe and persistent nausea and vomiting. We're not talking about feeling sick once in the morning. We're talking about vomiting multiple times a day, sometimes dozens of times, to the point where you become severely dehydrated and malnourished. A hallmark sign is significant weight loss, often more than 5% of your pre-pregnancy body weight. While normal morning sickness can be a nuisance, HG can completely incapacitate you, making it impossible to work, care for your family, or even perform basic daily tasks. The difference is the severity and the impact it has on your physical health and overall well-being. It's a relentless, all-day, all-night battle. Understanding the risks associated with HG is crucial for getting the right help. When you can't keep anything down, the most immediate danger is dehydration. This can lead to a cascade of other problems, including electrolyte imbalances, which are essential for your body's nerve and muscle function. Another serious complication is This happens when your body, starved of energy from food, starts breaking down its own fat stores for fuel, producing ketones as a byproduct. While this is a survival mechanism, high levels of ketones over time can be harmful to both you and your baby. Nutritional deficiencies are also a major concern. Without essential vitamins and minerals, your health can suffer, and it can impact the baby's development. It is a physically and emotionally draining condition that should never be dismissed as just a normal part of pregnancy. So what causes this extreme condition? While the exact cause isn't fully understood, research points strongly to hormonal factors. The primary suspect is the pregnancy hormone, human chorionic, or HCG. Levels of HCG rise rapidly in early pregnancy, and women with HG often have significantly higher levels of this hormone. Genetics may also play a role, as the condition can run in families. There are also certain risk factors that make some women more susceptible. For instance, HG is more common in first-time pregnancies. If you're expecting multiples, like twins or triplets, your risk is also higher due to the increased hormone levels. And unfortunately, if you've had HG in a previous pregnancy, you have a much higher chance of experiencing it again. It's important to remember that this is not your fault. It's a medical condition driven by the physiological changes of pregnancy. Now, for the most important part, how is HG managed and treated? I want to be absolutely clear. This is not something you just have to tough out. You deserve effective treatment and support. The first line of defense is often medication. Your doctor has several safe and effective options they can prescribe. A common one is a combination of doxylamine, an antihistamine, and pyridoxine, which is vitamin B6. This combination is specifically approved for treating nausea and vomiting in pregnancy. If that doesn't provide enough relief, your doctor might prescribe stronger anti-nausea medications like ondansetron, also known by its brand name Zofran. Other options include Metoclopramide, which helps to empty your stomach more quickly, and promethazine, another antihistamine with potent anti-nausea properties. It's all about finding the right medication or a combination of medications that works for you. Never hesitate to advocate for yourself and communicate with your doctor about what is and isn't working. In more severe cases of HG, ethyl medications might not be enough, and hospitalization may be necessary. This might sound scary, but it's often the quickest way to get you stabilized and feeling better. The primary treatment in the hospital is intravenous, or fluids. This rehydrates you directly and replenishes those essential electrolytes that you've lost. Getting rehydrated can make a world of difference in how you feel and can help break the cycle of vomiting. If you're unable to eat for a prolonged period, you might also need nutritional support. This can be delivered through an IV, a method called total parenteral nutrition, or TPN, or sometimes through a feeding tube, like an NG tube that goes through your nose into your stomach. In very persistent refractory cases where other treatments aren't working, doctors may even consider using steroids. The goal is to stop the weight loss, correct the dehydration and malnutrition, and get the nausea and vomiting under control so you can have a healthier pregnancy. While medical intervention is often necessary, there are some complementary strategies you can try at home to manage the symptoms. Of course, please discuss these with your doctor first. For hydration, many find that sucking on ice chips or frozen electrolyte popsicles is more tolerable than drinking liquids. The key is small and frequent. Try taking tiny, constant sips of very cold, clear fluids like water, diluted juice, or broth. When it comes to food, think small, bland, and frequent. Keep some plain crackers or dry toast by your bed and try to eat a little something before you even sit up in the morning. An empty stomach often makes nausea worse. Some people also find relief with ginger, whether it's in the form of ginger tea, ginger ale, or ginger candies. Acupressure bands, which apply pressure to a specific point on your wrist, can also be helpful for some. It's about finding those little things that can give you even a moment of relief. Finally, and this is critically important, you need to know when to seek immediate medical help. Hyperemesis gravidarum is a serious condition, and there are red flags you should never ignore. If you find you're unable to keep any liquids down at all for more than 12 hours, it's time to go to the hospital. Other warning signs include feeling dizzy, lightheaded, or faint when you stand up, which are classic signs of dehydration. Pay attention to your urine. If it's dark in color and you're urinating infrequently, that's another major sign of dehydration. Also, be aware of symptoms like a rapid heartbeat, extreme fatigue, or confusion. These are signs your body is under significant stress. Please, don't wait it out, hoping it will get better on its own. HG is treatable, and getting prompt medical care is the best thing you can do for both yourself and your baby. You are not alone, and help is available. Living with HG is not just a physical battle. It's an immense emotional and mental struggle. It can feel incredibly isolating. You may feel guilty that you're not enjoying your pregnancy, or frustrated that others don't understand the severity of what you're going through. It's so important to build a strong support system. Talk to your partner, your family, and your friends. Explain what you're experiencing. There are also amazing online support groups and organizations, like the HER Foundation, that are dedicated to providing information and support for those with HG. Connecting with others who have been through it can make you feel so much less alone. Remember to be kind to yourself. You are growing a human under the most difficult of circumstances. You are a warrior. If you are struggling, please reach out to your doctor or a mental health professional. Your mental health is just as important as your physical health. Thank you so much for watching and for allowing us to talk about this important topic. If you or someone you know is struggling with severe nausea and vomiting in pregnancy, please share this video with them. And remember to talk to your healthcare provider. You deserve to be heard, and you deserve to be treated. Don't forget to like, subscribe, and hit that notification bell for more content on navigating a healthy pregnancy. We'll see you in the next video.